Good afternoon, everybody, and welcome to today's webinar, where we will be discussing and analyzing the findings from the 2016 Industry Pulse research, and discussing about how we're putting these things together, putting these pieces together as we discuss emerging care models and value-based care and the transition of the market into those areas. Today's speakers will be myself, Chris Link. I am a consultant in the Business Development and Engagement team at Change Healthcare. And also speaking with me today will be Ferris Taylor, Office of the Chair for the Healthcare Executive Group, who has been our partner in this research for about 7 years now. As a quick introduction to Change Healthcare, we did announce that we did have a transaction close recently, and we'll be launching a new company called Change Healthcare still with McKesson Technology Solutions, and we're very excited about that. And you can see here really what our focuses are going to be as we move into that. And also just to quickly illustrate the breadth of what the combined Change Healthcare will do, and we really touch so much of the industry. And that's one of the reasons why doing primary research is important, is because we touch so much of the industry. We need to make sure we're learning as much as we can about the things that are changing, about the shifts, and discussing those in a way that is centered around sound market research methodology. And I also would like to invite Ferris to introduce the Healthcare Executive Group for those who may not be familiar with the organization. Ferris?
Thank you, Chris, and thanks to each of you on the call for sharing your time with us today. I will also say that both Change Healthcare and McKesson have been 2 of the 10 sponsors of the Healthcare Executive Group for a number of years. So the merger that Chris mentioned is very important to us. I'll be brief on HCEG, as you can find more on our website, which is indicated there on the slide, hceg.org. We were founded 27 years ago when Digital Equipment disbanded their healthcare users group, and we still function somewhat like a multi-sponsored users group, but with the discussions more among the healthcare stakeholders as opposed to a users group solely focused on a single vendor. And Chris, if you go to the next slide, I have been on the board of HCEG for 13 years, most recently in the office of the chair of the board, and have really enjoyed my participation with the executives across the country, addressing or discussing and working to solve healthcare issues. As you see, our purpose is to promote the networking and exchange of information and ideas and experience in healthcare, primarily to accelerate that transformation of healthcare. And this webinar today and the research that Chris and I have been involved with for a number of years on an annual basis is core to that. Our big vision at the end of this is to have an optimized healthcare system, and that will only be possible if we have the collective views and discussions and perspectives of healthcare executives such as each of you on the webinar today. So, this discussion and this research is very timely, given the showdown over healthcare the last few weeks, and there's still a lot of uncertainty. I view, and the next slide, Chris, I view the HCEG top 10 issues, and these issues are voted on annually by our members at the end of our three-day annual forum. And these are issues that are independent of what's going on politically or in the federal government or at the state level. I think as you look down these, they are cornerstones of activity that each of us can be involved with and control ourselves. So we have, since 2010, as Chris indicated, partnered with Change Healthcare to validate and further enlighten across the industry this HCEG top 10 list.
Thanks for the intro, Ferris. So the HCEG top 10 that we see, I do want to mention real quick, we use this as a guideline for for developing and putting together the actual survey. So this is really our rails that we start to follow and figure out where we want to focus. So a little bit about the industry pulse. The goal here is to provide directional insight on key trends and issues facing payers, providers, and the businesses that serve the market. And that's key about the businesses that serve the market, and I'll mention that in just a second. As far as distribution, we have a pretty wide net we cast. We reach out to healthcare leaders around the country through Change Healthcare contacts, through HCEG and their contacts and their sponsors, and also the Health Plan Alliance has been a partner in outreach as well. And participation, we tend to have, based on the question, between 75 to 140 healthcare leaders responding to this survey. So just real quick, I want to show a breakdown of our respondents. You can see that we have quite a spread. Traditionally, the industry pulse has been focused on health plans, and with the way the market has been changing, we wanted to change with it and bring in a wider perspective. So we really went out of our way to start bringing in provider voices and the voices from the technology innovators and government entities and really all the people who are out there making things happen in the industry and trying to solve problems. We wanted everyone to be part of the conversation. But at the same time, we didn't want to lose focus on our core audience, which really around the director and up level. And you can see on the right that we did hit our target, where most of our respondents are directors or up, with most of our responses coming from presidents and C-suite level members. And with that, we'll go ahead and move into the actual information. So this is a bit of a scary chart, but what this chart does is it tells what I think to be an interesting story. We broadly asked what the impact of clinical and data analytics have been on the factors you see on the left. And the response was very much mixed. We were hoping and thinking we'd see more very effective responses. And what we ended up getting is a mixture leaning towards not effective. And so this is really suggesting that we have a long way to go across a lot of fields. There are some early victories, but there's a lot more that needs to happen and probably will happen, based on the energy, the excitement in the industry in applying analytics to a range of challenges.
And I would say, Chris, as you transition to more detail there, that we're leading with this survey result primarily because data and analysis is going to be critical to almost every one of the HCEG top 10 issues. How can we get to value-based reimbursement, the number one issue, if we don't have data? How can we engage the consumers in behavior change if we're not able to see what is happening and dig deeper into it? I know I always kind of go clear to the bottom in terms of the initiative to improve population health. Thank you, Chris. We're, in the long run, and it's hard for the healthcare stakeholders to look at the long term, but if we're never going to impact the costs, we're never going to change the healthcare system if we can't improve population health, which is going to require all of those things above it. It is still surprising to me that in terms of slightly effective or not effective, our internal assessment as you look down that chart is still only about 50% when you combine those two. Extremely effective or very effective is still very, very low percentages, or our assessment across the industry is low percentages. So we do have things to do there, Chris, and I'll let you dig further into that data.
Sure, thanks, Ferris. And I do want to go down one layer deeper just to illustrate that this really is a journey. And what you see here is we took that highlighted population health, so the question about what has been the impact of analytics on population health and improvements there. And I asked, is there a difference between payers, providers? Is there a difference between the perception of those on kind of a layer, the kind of next layer over, the vendors and consultants, and how they perceive things? And we can see here is it suggests that there isn't really a difference. There's no real difference in effectiveness. We are very much, no matter where we are in the industry, in sort of the same spot, and that just says more clearly that we have a long way. We have a ways to go. There are things to figure out, and it's not payers and health plans trying to figure out one thing. It's not providers; they've got something maybe figured out. Everyone sort of rose to, they're in the same spot, because this wasn't just true for that population health one. It was true for all of the items in that list. It was all uniform across. This is just a really good one for illustrating that.
And don't be concerned about the fact that segment vendors and consultants do view that market differently. Some of that is really where a lot of the focus is on the part of those entities in terms of improving and expanding the impact of clinical and data analytics. And some of it is wishful thinking, more forward thinking. But as Chris said, the consistency between payers and providers when we broke this data out is very stable. I would also say off to the right you see in quotes, that is not our quote. Those are comments that came during the process of Industry Pulse. And I agree wholeheartedly. We have to stay innovative and not become distracted by all of the chaos going around us as this clinical and data analytics is absolutely core to our future.
And so the next sort of big question we asked was just sort of a level-setting question. We asked, and really thinking about providers and the health plans here, what methods are you currently using to manage your member risk? And the response is not too surprising with the lead response, really, disease and medical management. That's a fairly traditional way to go in and manage risk by managing the disease and managing the treatment of the patients or your members. So that makes a lot of sense. And what's interesting to then see is, as you go down, are the things that follow up. So we have the alternative reimbursement models. We talk about value-based payments, the increased provider risk sharing, and the concept of bundled payments. So I think you definitely see a movement towards these new models, and then you do see things like ACOs at the bottom. Certainly that's a massive undertaking to set up an ACO, and even having 30% is a pretty good showing for such a large undertaking. And then I will say, I pulled the quote on the right from some open-ended responses, and I think it's interesting when compared to that 65.8% for disease and medical management, because it's saying that even though that's kind of what you'd expect to see disease and medical management, but there's more that can be done there. We can do a better job as an industry of disease and medical management by using data to focus on treatments that are effective for the patients that need them and decrease the unnecessary treatments. So there's even new developing opportunities in fairly traditional areas.
And I would reference Chris. Chris and I and a group of about 30 executives had a wonderful meeting 10 days ago in Napa, California, and we focused just on value-based, we called it value-based relationships, value-based reimbursement, but it covered those number 2 and number 3 topics here. There is on the HCEG website a summary of and some pictures of flip charts that were taken from those discussions. I'll just refer you there for further thinking and discussion around how we get to value-based relationships as opposed to the more transactional relationships that I think represent the current state in healthcare.
Okay, so another historical question we ask, so as we move away from just the medical management and those things into some of the more, one of the financial questions, for the past couple years with the exchanges having launched and all of the challenges that those have presented the market, we've asked what the impact ACA reforms have been. And on the right side, you can see what we saw last year, in which it was, trending a little bit towards the worst side, but ultimately, reasonably balanced given the number of respondents that we have. Whereas this year, we saw a really drastic change, and we'll have another data point later that'll discuss this in a different way and a little bit deeper to provide perspective. But it's really interesting to see the shift from having this sort of very balanced or somewhat balanced distribution to a very skewed distribution in terms of the financial impact.
And I would suspect, I think you mentioned, Chris, this research came out of the marketplace just a few days before the November elections last fall. And so that's the result you're seeing here. I would suspect, given the developments over the last month or two with the Trump administration and the failure of any significant repeal and replace initiatives, that this change could have shifted even further. We will see, as the exchange markets at least take place, the applications go in for products on the exchange, whether more health plans drop off the exchanges, whether more provider groups decide to put together their own insurance plans and come onto the exchanges. But this is not a trivial shift in perspective. We've been doing this research, industry pulse research, for 7 years, and we'll show you the trends over the results of that research, but very seldom have we seen this dramatic of a change. I think you all are well aware of it. So, key insight.
Yes, and here's the other data point that I mentioned that really popped out to us. So this is another question we've been asking a few years in a row about really the sales productivity. So when we say productivity, is the expectation for a channel to be driving business. So this is really a health plan focused question. And it is asked over what are your expectations over the next 3 years. So when we asked in 2015, it's really, okay, what do you expect to see in 2016, 2017, 2018? So it's always a little bit overlapping, which creates sort of a very interesting, when you're thinking a lot of longitudinal data that we're building up, it creates a very interesting analytical opportunity. But it's pretty stark what we saw, and that is that we saw the 36% in 2015 felt like the public exchanges were going to be the most productive channel for their business move over the next 3 years. A year later, because we gathered this data late October 2016, we saw it drop. I think this is roughly, if I did the math right, 52%. So we saw a 52% drop from 36% to 16% year over, which is very, very dramatic. And there's a number of factors that we could look towards and dive deeper to see if that would, what may have been the cause. I think certainly around election and politics, there was some hesitancy, uncertainty if there was going to be a penalty next year, if people would pursue that channel if they didn't have to. I think there's a number of factors that could have played into that change, of course.
And I would add to that, Chris, and I do agree, that was a dramatic shift, but we also saw major health plans, Aetna pulling off exchanges in a number of their states, other major plans doing the same thing. So that one statistic is really insightful here. I would add to that, as I've looked at the data and looked down across the 6 categories, the 3 that actually moved or improved in terms of their expectations were all 3 things that health plans or payers in the marketplace control themselves. Direct sales or web-based sales, actually, where they're not dependent upon an exchange or a government-facilitated solution, but they're looking at saying, I'm going to do more of that. The same with single-payer exchanges. Here in Utah, we have the major health plan saying, I don't even know if we need a small group exchange. We have our own exchange, and we can promote our business on that single-payer exchange. all the way down to the bottom where we're seeing significant changes in storefront, direct resell, retail outlets. Those are things that we as healthcare stakeholders actually control ourselves independent of what the government might be doing. So in complement to Chris's observation on the public exchanges, I encourage you to look at the results from a personal point of view and say, what can I do, what can I control while the rest of the outside market stabilizes over the next 6 months to 2 years?
Yeah, and I do think that there's a broad message that sits around this year's survey to say that a lot of the things here that are out there for us to address, and they're challenges for the industry to overcome in a number of very creative ways that so many of which I don't think we've discovered yet. So it'll be interesting to see how responses to these factors evolve as we go through 2017. And speaking of kind of innovations and things and moving into kind of the technology aspect, we wanted to talk a little bit about access to care and find out a little bit about how the industry is responding to access to care and improving access to care. And what we found is, you can see, like way at the top, well over half of respondents said that telehealth is seen as the best path towards improving access to care, and it's not too surprising. I think my insurance offers telehealth, and my physician independently offers telehealth. It's becoming more and more common, and in fairness, I think we were discussing just the other day that there's only one state that still is preventing telehealth, and so and just a few years ago there were far more states that were blocking telehealth. So it's very much seen as a path towards making a difference to access to care. What I think is really interesting are the next three things in this list. So more primary care providers and more urgent care centers. And these are pretty straightforward things. There's a lot of talk about physician shortages and the number of physicians available for the rising population who needs treatment, and urgent care centers, more places for people to go for care more conveniently. But these are just very basic access to care things. More physicians, more facilities people can access conveniently. They're not huge, innovative, earth-shaking things. They're just, we need to provide access. And here are the things that are limiting our ability to do that. What I like to see on here are the mental and behavioral health programs. So this is really about integrating mental and behavioral health programs into care, not keeping them separate, not having them as separate concepts. And I think that's really key, and it definitely represents a shift in how we're thinking about healthcare as a more holistic process.
And I'd add to that, Chris, and we try very carefully not to impose our personal biases on any of this research, but even up at the top with telehealth, as I mentioned 10 days ago in the value-based reimbursement discussions, it still shocks me after, 20 or 30 years that telehealth is still at 50%. I see a question come in here that we'll address at the end with respect to changing consumer behavior and wellness programs and like that, and we still have a long ways to go on all of these, but it does the impacts fall off quite significantly, and each of us as stakeholders in healthcare can play a role in each of these areas with respect to improving the access to care, and improving that access. And I use the example many times, I'll use it for telehealth. You know, if you've got a young mother with a working husband and 3 children, and one of the children gets sick, you know, the whole day or 2-day schedule has to be arranged. Dance classes, or getting Susie to dance class and getting Johnny to soccer while I take one child who's sick to the doctor. That, opposed to being able to get on the phone at my convenience and determine if it's serious enough that I need to go to the doctor, or resolving that medical situation right there. These are all critical issues, but we have a long ways to go on each of them.
And Ferris, because I think it's pertinent to this conversation, we had someone ask, how do you all define telehealth? Would you mind sharing real quick how we're defining health
Sure.
for these questions? Thank you.
And an excellent question, and we always struggle and have for the 15 years that we've been doing the HCEG Top 10. I have paragraphs that describe each one of the top 10 in detail, but for the research, we made that telehealth a very big category, and you're right, it can be doctors consulting with doctors over a patient's condition. It could be chronic health management. It could be phone, video, computer-assisted health, all the way to the to just picking up the phone and calling 1-800 telehealth and getting a state licensed board certified physician on the phone. So it's a very broad definition as opposed to anything narrow, and obviously in this type of research we've had to keep that definition very broad. I don't know if that answers your question. If you want to put an additional question in, we can take that at the end and go into more detail.
Thank you, Ferris. Yeah, I mean, definitions are always a challenge, and you just try and make it as clear as possible in the research when people are responding. And we try not to narrow people down. Actually, if I go back real quick, that's why a lot of times we like to include the other options to fit those sort of things in. And especially with this question, I was glad that we had the other option, because the quotes you see on the right were actually responses to that other category. So these were self-reported amongst our respondents. And you can see these are things that talk about care managers and care advocates, saying we don't just need primary care physicians always, we just need to have people more engaged with their care and care being monitored actively. And then we have the other option, the needs-based assessments design from community to health systems, so a needs-based assessment that's connected from beginning to end of the care process. So some very interesting ideas coming in through that open forum. So we did ask another question related to really to go more about into the technologies. We were looking at what is currently impactful and what will or will not be impactful, with some just kind of a broad spread of categories. And what I really like to take away from this slide, because is the difference between the wellness apps, fitness trackers, and the health monitoring devices. Because when I see these two items, I think about the data they're producing and collecting, not so much the ability to have someone count their steps or be more aware of what they're consuming and finding health that way, but more about the data that could come from this and could be shared. And I think about what that could do moving forward in terms of impact. And there are questions floating around right now about the quality of data that we get from these wellness apps and fitness trackers. Like, does the data actually have something that a physician or a health plan can use to predict health problems or treat somebody? There's questions around that, whereas with a health monitoring device like a Wi-Fi, a pacemaker that can connect through Wi-Fi, or a glucose meter that is being uploaded and that data being shared with the physician of the diabetic person, where it's producing measurable data more frequently, that can actually be used to maybe, okay, well, we know this person is not great at regulating their insulin, so we want to make sure we keep a special eye on them because they may have a problem we can get to first before it's a critical issue. Things that, so I think it's really interesting to see the data like this, because the impact of those health monitoring devices makes a lot of sense from a data perspective. You can estimate a lot more impact in the future as those things continue to develop and gain prominence.
And I know we need to move through the rest of the research. On the left-hand side, wellness apps, what I view as kind of a neutral market, a pessimistic market as to the impact of those. I think some of that is that we as an industry still don't take that long-term view of healthcare. If we don't focus on wellness and behavior change and fitness, we're going to continue to fill the bucket of poor health faster than we can drain it. The optimistic view on the right-hand side with respect to what is there. At the core of this, as Chris has mentioned, is how do we consume and analyze and process and make the data that all of these systems will generate and make it available in a timely and a real-time basis to decision-making. The Healthcare Executives Group will be having another executive leadership forum May 8th, the day before the Blue Summit in Orlando. And we decided to make that entire topic to be around data and analytics because that's core to each one of these digital health technologies that Chris has outlined here and we surveyed on. So more to come there. We can't solve all of this today, but the data is very good observations for you as stakeholders in healthcare to focus your activities and provide direction to your priorities.
All right. So now we get to actually one of my favorite questions. So we asked pretty directly, what do you see producing more value, cost transparency or quality transparency? Which one is going to be needs to be the first priority? I think cost transparency being pretty apparent, whereas quality transparency, we're really thinking about that from understanding from an outcomes perspective. So that could be just really being able to clearly measure outcomes long term, and also as it relates to the consumerism aspect, the ability to see the quality care that a physician or provider is delivering to the market. So this is definitely a consumer slanted question as a whole, but it's also a tough question because you had to choose cost transparency, quality, or neither. And I even had a few people who were colleagues of mine who took the survey who, when they finished, had sent me an email or gave me a call and said, "Why did you make me choose?" And we made them choose because it's difficult. This is definitely not a right answer question, but we did see pretty clearly that when forced to make a decision between the two, cost transparency captured 58% of all respondents. And then when we broke it out into payer, provider, and sort of the vendor category, it became, it makes a lot of sense. Payers a little bit more focused on the cost transparency. Providers, slanting a bit more towards the quality transparency, but still firmly in the cost transparency camp. And then vendors being kind of the pseudo control in this instance, likely because you've got a blend of vendors who serve payers or serve providers or serve both populations. So you may see a variety of solutions that shape that impression. That's an assumption that we've been making in our part, but certainly to show that there is a balance and a lot of blending. And then we did go down another level. So we asked everybody after they selected cost, quality, or neither. They received an open-ended question that said, why should the focus be on cost, quality, neither? Whichever one they chose, that's what they would see. And we saw a real spread in their responses, and that gave us perspective on the complexity and further addressed the hypothesis that there isn't a right answer. Both these things are important. It's how we actually are planning on approaching and addressing these. And all of the bullets, these are basically paraphrased blurbs for the open-ended responses that we got. And you can see the variety in the range. So in cost, because we need to focus on cost to improve patient education, to improve access to care, cost management, managing patient costs in general, providing access to pricing information. So there's several related things there, mostly around the patient and getting them access to more information and better managing the patient as a customer. On the quality side, you see a range as well. Just abroad, we need to focus on quality over cost savings. You always have to deliver better quality. Medical necessity, focusing on delivering only necessary care, not extra care. And then long-term results. So we need to focus on quality because long-term results so high-quality long-term results will mean we have better cost control. So you see it keeps tying back to cost. And then the neither category gave us some of the most interesting responses. And that you see neither provides a full perspective, or transparency is evidenced by outcomes. So if we know how to track outcomes clearly, then everything else will follow. And then really interesting, the last bullet point saying both require changes in documentation and workflow at the physician level. This suggests to me, and it would have been great to be able to dive deeper into this response with the person who left this comment, because it suggests that in order to address cost and quality, we need to have a better understanding of the basic points. From that point of engagement, that point of care, we need to have a really clear picture of what's happening from a cost, from a quality, from a care perspective in order to begin addressing these bigger questions about how we address this for a provider network or for a health plan or for the entire healthcare industry. So it says maybe we have to go back to the most fundamental of fundamentals and go to the doctors and make sure that we're working with them to address and figure things out and get to that workflow level.
And I was one of the ones, Chris, that was saying, I hate you for forcing me to choose cost versus quality. And I'm probably in the neither camp, and I'm in, or both camp. And your last point is a critical one. I'm reminded constantly and share quite often Michael Crichton's quote in Lost Worlds. And the quote is simple. Extinction is the inevitable result of one of two things: too much change or not enough change. And I do believe on cost and quality, we have struggled as an industry on both, on being willing to be transparent around costs. And I see a question here that we can go into in more detail at the end, but really challenged on the quality side as to what the measure of quality needs to be. It's easy to say, well, the measure should be outcomes. But then that runs in the face of is the outcome a short-term result or a long-term result? And I guess I would shorten my comments to a colleague I worked with back at Harvard Pilgrim many years ago, Harvard Community, Don Berwick, when he was heading up CMS, and he took the position that if we focus on quality, the cost will follow. And I think operationally that is the case, but we still have the transparency issue that this question really caused us to focus on, and that probably needs to be our next leadership forum and discussion just around cost and quality, Chris, but we could spend the day on that. I'll let you go on.
Mm-hmm. Yeah, I want to be respectful of time, so we're going to make sure we get through all of these because I think we've got some cool stuff still to come. So because pharmacy has been a big topic, we did want to start dipping our toes in the world of pharmacy and just quickly poll our respondents about what they thought would be a great path towards controlling pharmacy costs. You can see there's a range of responses. One capturing 50% is increase the availability of generic drugs. Not too surprising there as a way to control costs. And certainly you can see on the right side again. There's some open-ended answers that there's definitely a lot of ideas, and that's really the takeaway here. Is there's a lot of ideas for how to control pharmacy costs. And we may have to implement several of these possibly to actually address the problem.
And clearly, I saw the statistics that pharmacy costs now have gone over 20% of the total medical spend. That's a dramatic change. Do we want the government, Medicare, Medicaid, which is 40% of the healthcare spend, to negotiate drug prices? We saw in the AHCA initiatives by the GOP that they wanted to allow imports of drugs. This is a topic that's going to get more attention. There have been, of course, highlights of the bad players, even on the generic side. The costs of some generics have gone up quite significantly over the last year or two. So controlling, and it relates back to that cost transparency. How do we get transparency out of the PBMs in terms of rebates and all of that? So the research definitely highlighted, but it gives us some priorities, at least from the marketplace, as to paths that each of us as stakeholders could pursue in our individual drug cost spend.
Mm-hmm. Yeah, definitely. So another big, scary chart, but this is our longitudinal question. There's a single question we have asked every year for 7 years, and that is around. It's a very large matrix question to say what are your critical priorities, what are the things that are not as important, and we've been tracking those over 7 years to see how it's changed. And you can see in the colored text how this has shifted. First looking at customer service, 2010 to 2016. It rapidly rose over the course of 4 years from being a lower priority to now being a critical priority to being the critical priority for the past 3 industry pulse surveys. Certainly we saw privacy and security leap up. It was always somewhat a priority, definitely on the lower side. For a while, it would dip on and off the list of making that lower priority bracket. And then in 2015 and in 2016, certainly there's a lot more emphasis on privacy and security. Certainly the news would suggest we know exactly why that is. A lot more breaches, a lot more concerns. And then in 2014, so the last one I'll draw your attention to, we added data analytics to our questions. And it immediately jumped to being a critical priority, and it has stayed there, which is why we have this slide titled healthcare may be settling into new normal. Because even when we introduced a different blend of respondents in 2016 this year, it caused a bit of a shakeup in priorities, as you'd expect, having more providers and others giving their input. But those 3 items stayed the top 3, even with that shift, which tells you how critically important they are.
And I think, Chris, the last question we included is around privacy and security. That's probably the one that bounced to the top with the Anthem and Primera breaches, over 100 million medical records lost. And the importance of that is not just financial implications, but medical identity implications. I'll be very brief. We had a baby born here in Utah about a year ago that was heroin addicted, and as soon as that was identified, they went to the mother's home, and her 3 children were taken out of the home. The problem was the mother whose children were taken was not the mother of the baby. It was medical identity theft, and that mother had disappeared. It took 3 or 4 months for that family to get back together. That kind of medical identity theft is just beginning for us if we don't get around cyber security problems. So, Chris, back to you.
Yeah, and I won't spend too much time here. I think this slide just suggests that there's a wide variety of avenues of threat, and Ferris, when Ferris first shared that anecdote with me about that mother, it creates it is a real issue, and it affects people in very personal ways, and so it makes sense that there's a lot more tension, and that we have to look at a variety of sources. And these are just the top ones. These are the top 6. There were even more, but these are all the ones that were either about 25% or up. So, and here we have these are sort of the motivators, and I'll just speak to what this slide is illustrating, is that there are internal and external motivators as well for why there's concern. It's not just regulation. It's not just concern about public appearance or brand damage or liabilities. It's all of these things. And there's even some skepticism. We had a few people say, it's not as bad as the industry makes it out to be. It's a lot of marketing. But reality, and you can see in the quote down here, in relation to security and ransom attacks, there's more exposure to third-party systems. Technology, there's a lot more technology involved. There's data analytics being used, new data sources being opened. We have to pay attention to these things, and there's a lot of reasons why. You can see those on the screen in front of you. So the last 2 questions that we ask every year are big open-ended questions. We ask, what are the big challenges you expect to face in the next year? What big opportunities do you see for your company in the next year? And I use word clouds as an analysis tool. We get a lot of responses. Some of them are very long, and I love to have that, but I use these word clouds to help me dial in on what the keys are. And so using this word cloud, and I just like to share it because it's always kind of cool to look at, we were able to break out the challenges into these 4 broad categories, and the word and the sentences in italics are direct open-ended quotes that we received. So the big challenges being regulations, costs, data security, and emerging care models. And I think certainly regulations, cost, data security makes sense. Those are what we expect, especially given the data that we've just reviewed. But the emerging care models, I think, is interesting because it's not just that it's a challenge to get them up and running because, well, you have regulations and you have costs associated with them, and you have data and security issues associated with them. So those challenges all play into the single one. But it also, and we'll see in just a second, is an opportunity that the industry has seen. And we'll kind of wrap this into one big bundle. So if we look at the opportunities, this same thing. So this is just analysis tool I like to share. But if we move into the categories that derived from those responses, we have consumer experience, we have care quality, and we have care management. These are all things that play into these emerging care models. It's about improving the consumer experience. It's about improving care quality. It's about managing care for patients in new ways, the ways that are more effective. And ultimately, what the culmination of all of this is that if you can conquer those challenges around costs, around regulations, around data and security, and you can implement these emerging care models and manage care and improve quality and reach that consumer experience, all these opportunities, those companies, whether they're a payer, provider, or vendor, are going to see market growth because they're going to have that advantage. And that's definitely through the data that we reviewed and these open-ended responses, that narrative that really emerged through this process. Through the process doing the 7th annual industry pulse.
I think the important thing is the summary and the challenges and the opportunities that are there are all things that we can control. It gives us what I like to call the anchors in healthcare of things that we can do to improve our market position and healthcare in general, independent of which way the political winds are blowing or what particular states might you be doing from a regulatory point of view. These are fundamentals. These are core. And we can focus on those and move the industry forward independent of everything else going on around us. But you have some very good, solid information here that you can use within your management team, whether you're a provider, a payer, a vendor, or an employer, to be able to focus your initiatives on the things that will best impact your organization.
Yeah, and I think that's really the ultimate message, is that this provides all of us, the researchers, the providers, payers, et cetera, it gives us a path that we can start walking down. Ferris, any final comments before we let everyone go?
Yeah, Chris, on behalf of HCEG, we want to thank you and Change Healthcare and the new Change Healthcare with McKesson's HIT capabilities for the time and effort that have gone into this. For those of you on the call, if you want to continue these discussions, there's information there on our next annual forum, which will be in Nashville in September. Thank you so much for your participation.
But again, thank you so much. Have a great rest of your week, and I'm really glad you could join us for this today.